I'll be sharing my COVID journey. Hey guys! Welcome back to my YouTube channel. So kung hindi ka pa nakasubscribe, mag-subscribe ka na to get more updates. So, ayun. Good morning to everyone who's watching right now. Good morning, good evening, good noon, afternoon. I'll be sharing my COVID journey to you guys. It's been 2 months now since I experienced COVID. So I would like to share the experience kasi I want to make sure that you guys are gonna be aware, people are gonna be aware. How does it feel? So first, the findings that I have is actually severe pneumonia and then severe COVID din siya. So paano siya naging severe? At first, ano ba yung mga bagay na naramdaman ko? So February 18, I felt sick. I feel like magkakaroon ako ng lagnat. Tapos nararamdaman ko na makati yung lalamunan ko. And then after that, parang the next day, nilagnat na ako. So, nung nilagnat ako, syempre it's the usual thing na ginagawa natin, di ba? So, iinom tayo ng gamot, ng biogesic, ano pa ba? Vitamins. And then after 3 days, minlagnat ko on and off siya. So, wala pa akong ibang nararamdaman. It's just, plain fever. On and off siya. So, say for example, in the morning, mawawala siya. So, I feel better. And then after, afternoon, ayan na siya. Parang sumasama na ulit pakiramdam ko. And then, paggabi na, mataas na yung lagnat ko. It's ranging around 38 to 39. Minsan may nag-40 pa. For the past 4 days na nilalagnat na ako. So, we decided to go to clinic. Nagpa-test ako ng dugo at saka ng ihi. Tapos, after nun, ang nangyari is, sa dugo, I don't have anything. And then with ihi, meron akong UTI. So, technically, pag may UTI ka, kaya ka talaga nilalagnat. So, I then think or I then thought that I'll have COVID that time. So, after namin nag-clinic, syempre there are antibiotics, prescription, ganyan. Then, umuwi na ng bahay. So, on the 6th day, I felt better. Parang wala na yung lagnat and all. Pero, inubo na ako. So, on the 6th day na inuubo ako, it's getting worse. So, nung naggabi, kasi friend namin yung family doctor, so we just had to text her or message her in Facebook. Parang nag-continue yung ubo for the whole day, and then the next day it gets worse. And then in the afternoon ng pang 7th day ko, sabi ko, ba't hinihingal ako? Parang pupunta lang ako ng CR, it's just like parang 7 steps away or 8 steps away from saan ako nagpapahinga, which is here. Dito ako lagi nung nagkasakit ako, dito lang ako sa sofa. Then when I tried going to restroom, every time I tried going to restroom, it will take me some time before I even got to the restroom kasi shortness of breath talaga. It's the only thing na naramdaman ko with COVID. I did not experience yung loss of smell, loss of appetite, o nawala ng panlasa, nawala ng paamoy, no. Yun lang, ubo and then shortness of breath. Before ako inubo, pinutusan niya kaming magpa-x-ray. So, dun sa x-ray ko, nakita niya na medyo cloudy. So, it can really be yung pneumonia nga. Pero she's actually suspecting already na it's going to be COVID din talaga kasi. So, sabi ko, I'll try this night. Kung mahirapan pa rin ako huminga the morning, magpapa-hospital na ako, sabi ko sa sarili ko. And then, the next day, it's the same. As in, wala akong ganang kumain. Pero, hindi ako nawala ng panlasa. And then, after nun, mas lalo akong nahirapang huminga. it's like few steps, ang hirap talaga huminga, like hinihingal ka na talaga. So I was kind of scared, I'd say, pero at some point I'm very positive that it's not COVID nga. And then we went to FEU, mga bandang patanghali na rin yata yun. And then so tinanong, is there any symptoms, ganyan. So yun nga, shortness of breath and then cough. So before I got admitted, they had to make sure, they had to run tests like x-ray, yung sa oxygen level, which is very critical kasi my oxygen level is at, I think I'm only at 80%, which your oxygen level should always be at 95% and above. If it's normal yung body mo, you don't feel anything. If it goes down 95, below 95% or even below 90%, you have to make sure that you have yourself checked kasi nga it can be a problem with COVID as well. So pagdating doon, syempre nagulat sila, it's 80% of oxygen level. So they had to make sure na i-oxygen ako while we're waiting kasi we have to wait for the x-ray result for one. And then next is they have to wait for the swab test result. So sinab na rin ako doon. I cannot be admitted because they had to confirm if may COVID ba ako or not. Kasi different facility in FEU for COVID patients and then for patients ng, let's say, pneumonia lang, ganun. So, meron silang isolation room dun lang sa labas before you even get to the facility of COVID while you're waiting for the result. Meron din ako nakatabid dun sa isolation on, para siyang tent na may aircon and there are din yung mga oxygen, ganyan. Meron din siyang kama, syempre. We have to wait for 24 hours for the result ng swab test. Tapos yun, nung pagka 24 hours kinagabihan, sinabi na nga sa nanay ko na positive nga daw ako. I'd say I wasn't shocked, pero I was also expecting na wala akong COVID. But at the same time, I was worried. I know that it's not gonna be hard actually. Pero by thinking during that time is that it's going to be hard for my parents. Kasi matanda na sila, inasikaso nila ako from the day na nagkasakit ako nung first week na on and off na fever, yung mga ganon. So I was worried if na hawa ko sila. So what happened was, we had to decide. Good thing though, in FEU, kapag na-admit ka ng COVID, pwede kang may kasama. It's just that yung mga kasama mo, they need to secure na hindi siya matanda. Possibly around 25 to roughly 30-ish age, para we can secure na mataas-taas yung yung immune system nila, or hindi pwede kasi pag matanda. So yung parents ko kasi is nanay ko almost at 60 and then tatay ko at 60 na. So yung doctors are really worried and they cannot be the one nakasama ko dun sa COVID room ko nga. So luckily I had my pamangkin, which is 27, I guess she's already 27. So pumayag siya na magbantay. She's not feeling anything naman, so we just had to make sure na may PPE rin siya doon. Meron siyang mask lagi, different kami ng gamit, ganon. She just had to make sure na maalalayan niya ako kasi nga konting lakad ko, sobrang hingal ko na talaga, like parang kala mo, sabi ko ba't ganon, parang sobrang hingal naman siya, as in naubusan ka talaga ng hininga. So even if let's say sa higaan ako during that time, pag bumaba ka, as in bababa ka lang ng higaan, girl, I'm telling you, di ka makahinga. So I always had to wear my oxygen. So nung time na nasa isolation ako, nag-start ako before we were waiting for the swab test, oxygen ako all the time. Naka-monitor din yung oxygen because it cannot go down. Kapag nag-go down siya ng mga 85, tutunog yung machine na nilagay dito na parang, di ko alam yung tawag dun eh. Oximeter siya pero it's a machine. Kasi yung oximeter, di ba, kiniklip lang siya dito. Yung isa na yon, nakaklip siya dito all the time. Kumbaga, monitor niya yung oxygen level mo the whole time. And then, So, I got admitted nga. So, my parents has to go home. And then, they had to secure a swab test as well. Luckily, dito sa Quezon City, merong libre. At least dito sa Batasan, I'm not sure in other parts of QC. Pwede kang magpa-swab. They undergone swab test lahat sila dito sa bahay. And, yun nga, my parents are positive as well. Yung ate ko, hindi ko siya nahawa kasi nung the entire time na nagkasakit ako, hindi siya din siya talaga sa akin lumalapit. So, it's really, pag mahahawa ka ng COVID, it's really yung laway talaga yan for sure. Kasi, nung interaction namin with my parents, nung may sakit ako, sobrang lapit kasi they had to give me food, tapos hinihilot yung ulo ko, yung kamay ko, yung mga ganun. Yung nanay at tatay ko. That's the reason why most likely kaya sila nahawa. Unlike my sister na hindi siya sa akin lumalapit at all. Hindi naman sa ayaw niya akong tulungan, pero it's not really necessary naman for her to go near me or anything. That's why. And then, yun na nga, nung doon ako sa FEU, I got admitted for 12 days. Total of 12 days ako nasa ospital. First day ko nung inakyat na ako dun sa room ko, sobrang hingal pa. I think it lasted mga hanggang 5 days. 5 days akong medyo hirap pa rin talaga huminga. Although, day by day, parang it gets better naman. Kasi, first day, they discussed na I had to pay for the COVID na fee. And it has to be cash. So, yung COVID na gamot, it's called Remdesivir. And then, it costs, kasi yung unang turok niya, for 2 shots na daw yun. I'm not certain if I can remember. For 2 shots na daw siya. So, it cost 22,000. So, syempre, yung nanay tatay ko naghahanap. By the way, hindi sila nakaramdam ng kahit ano. They are positive, pero they did not have any symptoms at all. Kaya sila din talaga nag-alaga sa akin the entire time. So, yun na nga. So, we had to look for 22,000 pesos because it's cash. And then, yung tatay ko may pera, pero we had to get the help sa asawa ng kuya ko kasi nga, they cannot go out kasi they have to isolate themselves dito sa bahay. And then yung ate ko lumipat ng ibang place kasi nga negative siya. They cannot be together during the whole isolation. So technically, while I'm in the hospital, dito sila sa bahay. Nag-isolate din sila for 14 days. Actually, the nurses are the only one who can parang get the things that they would like to give sa mga pasyente or sa mga kamag-anak nga nila na may pasyente ng COVID kasi we cannot go out dun sa room kasama yung bantay ko, which is yung pamangkin ko nga. During the first day ng COVID ko, dahil in-inform na ako ng doctor and ng nurse about the Remdesivir nga, that cost much money. 22,000 siya, 2 shots na siya. And then, next days nun, it's going to be 11,000 per shot. And it has to be 8 shots. So, that is roughly around 80,000 to 90,000. So, imagine it's cash. So, I think during that time, binayaran ng tatay ko yung para sa unang shot or yung first 2 shots, which is 22,000 in cash. And then, hindi naman sa nakipag-away, pero sabi niya, based on, tinento niya nila sa akin kasi we had to do video call. Because I cannot go out apparently or obviously. Sinabi nila dun sa cashier dun sa, I'm not sure what it's called, sa mga gamot or what, or sa billing department ng FEU, I'm not sure. How would we be able to pay for 11,000 every day, 'di ba? It's really a big amount of money. So, paano daw pwedeng gawin? Kasi I have my HMO card and then I have my PhilHealth too. May tatay is asking if pwede ba yung sa card ko na lang kasi I think we can spend at least 200,000 maximum dun sa card namin for HMO from the company. And then sabi nila I had to write a parang promissory letter or promissory note that if it's possible that they can put it dun sa card ko. Kasi nga, it's too much amount of money. We don't have that money. 100,000 like on hand. Luckily, pumayag naman sila. So, we just have to spend yung 22,000 first thing para dun sa 2 shots ko for COVID. And then, yung succeeding, they will charge it dun na lang sa card ko. And then yun, the experience is fine. The facility is okay. I'd say it's very comfortable. It's aircon. I have TV. And then, may pagkain sila every meal. Parang umaga, tanghali, gabi, ganun. Tapos may mga pinapainom na gamot. There are a lot of times tuwing madaling araw I had to take the shot nung COVID. It's around 4 a.m. So nilalagay siya dun sa dextrose ko. Parang it lasted for 2 hours. And then meron din mga nilalagay sa dextrose ko na gamot ko for my ulcer. Kasi yun nga, I have gastritis. And then yung para sa pneumonia ko nga kasi it's a severe pneumonia. So may mga iba pang shot na binibigay sa akin. And then on the span of 12 days, 3 times akong in-x-ray during that span to check if clear na yung pneumonia ko. And then, mga dugo, ganun, kinukuhaan ako ng dugo. And then, every day, they have to check yung kung may fever ba, how's my parang breathing, ganun. So, as the day goes by, it went okay kasi it's very comfortable din naman. And then, you are not really that stressed. Kasi you have TV with you, ganun. It's just the thought of you have COVID. Like, yung feeling na, shit, COVID, akong mamatay na ba ako and all. Pero if you are being treated right, correctly, and then nabibigay yung gamot sa'yo, may pambayad ka ng gamot, then it's all gonna go well. It's just that, the amount of money. So, in a span of 12 days, 5th day, okay na ako. I think on the 7th day, ni-remove na yung oxygen ko. Although, hindi pa siya smooth na. Kaya ko na agad maglakad-lakad, no? Kasi syempre, bedridden ka the entire time na nagka-COVID ka. So, I had to try na mapunta ng restroom. Kasi may sarili ng restroom yung room mo. Punta ka ng restroom para umihi, mga ganun. Kinakaya ko na siya. And then, on the 8th day, I guess, napapansin naman na siya sa akin na I'm getting better. Plus, the entire time na naka-admit ako in the hospital for 12 days, hindi na ako nilalagnat talaga. It's just the shortness of breath. Apart from that, wala. I eat well kasi I did not lose my appetite naman. So, may panlasa ako talaga during the entire time. And then, masarap yung pagkain kasi it's a mixture of vegetables, meat, tapos may prutas, ganon. So, maganda siya. And, pantay siya kasi nga, yung kanin niya, parang 1 cup of rice lang. So, on the 10th day, the doctor visited me, or yung doctor talaga ng for COVID, that, since I'm getting better, they just had to run some tests na lang if I can be discharged. And then, 11th day, I had the last x-ray. Tapos, meron din akong another swab test. And then, discharge na ako on the 12th day. Pero, nung na-discharge ako, I was advised to do another isolation, which means I cannot go home just yet. So, I had to go somewhere else. Malapit lang siya sa bahay namin. It's one of the apartment ng tita ko. So, syempre, it's a help that they offered na dun muna and all. So, I had to stay there for another 10 days. Kasama ko rin sa hospital, syempre. So, it's like our own isolation. And then, after 10 days, yun, I get better. I was able to go back to work after a few more weeks after that isolation. And then, on the other hand, natapos na rin naman yung isolation ng parents ko for 14 days. One thing that we have experienced, kasi nung sila pinag-isolate sila, they asked if they had to do another swab. Sabi nung health representative, I don't know how he was called, hindi na daw necessary, but so long as you're able to isolate yourself for 14 days, goods na yon, hindi ka na nakakahawa. Pero you don't have to have another swab test kasi it's gonna be positive most likely. Parang yung nangyari sa yung last swab test ko na discharge ako. They did not have the result, pero I was discharged kasi nga I'm good. Kasi again, hindi na naman dapat talaga siya nakakahawa. Kasi kagaya nun, when we have received the result, it's again positive. Positive talaga ulit siya. So, that's probably the reason why. Hindi ko alam kung saan ako nahawa, but I'm working on site. And probably I got it sa biyahe pa uwi because I had to ride, or I'm riding a bus every time I go home. Although kapag papasok ako, meron kaming shuttle service na tinatawag. But every time I go home, I had to take the bus. And then, recently, I am going to gym. So, I don't know if that's where I get it. Kasi yun yung bago akong pinupuntahan bago ako nagka-COVID. Kasi before, when COVID started or pandemic started, stay in ako sa work. And we still, meet people, talk to other people. Although, syempre, with the social distancing, the mask, and the face shield nga, diba? But, I did not get COVID at all. Most likely, the reason why my immune system was very low at the time. Remember, I mentioned that I'm going to gym. So, it's really a bad habit that I did after shift. So, my shift starts at, let's say for example, 10 p.m. And then, I will be out 7 a.m. or roughly around 11 to 8, mga ganyan. And then, after shift, I go to gym. So, I work out like for an hour, minsan 2 hours, ganon. And then, I had to take the bus, aircon. Di tanghali na siya, around 11 or 12. Sobrang init, hindi sasakay ng aircon, matutuyuan na ako from the gym. Then when I go home, I take a bath. So, yung parents ko, sinasabi nila that it's gonna be a problem soon. Yung usual na pagsasabihan ka ng parents mo na masama yan, hindi dapat ginagawa mo, ganun. And it did. I suffered a lot. That's where I started yun na nga nilalagnat and all. And then probably that's where I get the pneumonia. Kasi natuyan ako ng pawis from the gym. Sasakay ako ng aircon mainit. And then babiyahe pa ako papunta dito sa amin na after aircon sobrang init niya. And then pagdating naman ng bahay, ligo agad. Like ligo. Diretso ng CR. So it's really one thing that really caused me to parang mag-low yung immune system ko. And that's the reason why mas mabilis ako nahawa ng COVID, because I was in and out of home the entire time ng pandemic, which means I meet people, I still use the transportation, public transportation, yung mga ganon. But I did not or hindi ako nahawa before. Even with my friends na lagi kong kasama, they feel like they are sick, pero hindi sila like the severe na tumama sa akin. And again, it's probably the reason why bumaba yung immune system ko, because of the bad habit that I had. So, right now, I guess one thing that I could say, guys, is make sure that you drink your medicine twice a day if you're feeling something. Drink medicine agad, or at least once a day. Do not miss to drink your medicine. And then, do not have a habit na magpapatuyo ng pawis, maliligo, or whatever, mga ganong habit. It's not good. It can be the reason why pwede ka talaga mahawa ng COVID. And also, syempre, we all really have to practice the social distancing, the mask, face shield, and then alcohol. We just have to take necessary precautions talaga. And I think that's gonna help. All we have to make sure is malakas lang yung immune system natin, and definitely it's already gonna help us with COVID. And syempre, practice the right things to do. Eat healthy. That's where I started to eat healthy, and I lost weight. Before I went to gym noon, kasi isang buwan lang ako nakapag-gym that time. Before I went to gym, I was around at 89. Paglabas ko ng hospital, I was roughly at 83. Right now, I'm on 80 kilos na lang. So, we really have to eat right. Sabi nga nila, you are what you eat. Para, again, we have to make sure na mataas yung immune system natin. So, we have to make sure that we eat right. If you can exercise regularly, that's better. And then, yung mga bad habits, even alcohol and smoking. I don't think that's gonna help you. So at least when the pandemic's over, by all means do what you wanna do. But for now, I think we have to really secure to ensure lang na hindi tayo mahawa, or if mahawa man tayo, it's not gonna hit us big time. Kasi what I spent in the hospital is, or the bill that I had, by the way, is around 523,000 pesos. That's $500,000. I was just lucky that I have the HMO card ng company, and then the PhilHealth. Technically, ang nagastos lang namin in cash is 50,000. That's it. And I want to thank all the people who prayed for me during that time, who pray for my family. They at least offer help, yung iba kahit small amount, and I want to thank them for that. Kasi kahit pa paano hindi kami nalubog. Kasi imagine, after 12 days in the hospital for 530,000, I had to isolate again. Lahat kami walang trabaho dito sa bahay for 2 months. So it helped us survive. And I think one thing is, we really have to make sure that we help each other during these trying times, kasi it's still not over, and I don't see that it's going to be over soon. And during the time na nagkaroon ako ng COVID, it was like parang second wave. I'm not sure, pero yun yung tumaas na yung yung case ulit. Like 7,000 in a day. I was just lucky na I got admitted even before pa talagang nag-rise yung cases, and diba nga yung iba hindi na tinatanggap sa ospital. So yun. And of course, I want to thank God for the guidance and the life that He provided for us for the second time, because some of the COVID patients did not get the second chance. So we were still lucky, and I'm very thankful for that. I'm grateful actually, and my family is grateful na kahit pa paano yun lang yung inabot namin. But for the people of the Philippines, I hope that this will serve as a lesson learned for you as well, if you were able to watch this video, because it's gonna be at least an informative one, I'd say, for one, para you can avoid at least getting COVID or getting sick, and it's going to be another day for everyone. So yun lang. Thank you so much for watching my video and for listening to that almost 20 minutes to 30 minutes of your time, and I hope to see you on my next video. Thank you. Bye. Please follow, like, and